is Ruth Wanyonyi from National Cancer Institute of Kenya. I'm the head of partnership and resource mobilization. Today we are happy to be here on invitation of Honorable Martin Owino, who came and approached us, National Cancer Institute, to partner with them in this medical camp. And I'll say briefly about National Cancer Institute of Kenya. It is a semi-autonomous government agency which was formed under state of cooperation. It was also established under an act of parliament, which is Prevention and Control Act number 12 of 2015. One of our mandates, major mandate for National Cancer Institute is prevention and control. And also what we do as National Cancer Institute of Kenya is that we advise the Cabinet Secretary on matters cancer prevention and control. Other objectives of National Cancer Institute of Kenya in relation to this medical camp is that we create awareness to patients out there. As we all know, cancer is one of the deadly diseases in the world, and in developed countries actually it comes the third position after infectious disease and cardiovascular diseases. In our country, Kenya, we are focusing on cancer because many people actually lack awareness on cancer. And as one of our mandates, when we came here on this medical camp from yesterday, we came with our team, and our team of awareness, cancer awareness, have done a good job, and we have seen from the response, we have seen high response. When we started, there was low response, but as per today, many people are willing to do the screening. The major cancer that we are concentrating on in this medical camp is we have cervical cancer, which is common in women. Then we also have breast cancer, and we have also prostate cancer. That's what we are doing here. Cervical cancer, we are focusing on people who are in productive age. And by this we mean any girl who is sexually active up to the age of around 50, 55 years, we are testing them, and we are encouraging that many ladies to go for this cancer screening, and also to prevent, we also urge many to go for HPV vaccine, which at least will also prevent these diseases. On the prostate cancer, we have realized that there was a low uptake on men, and we have realized that it's because of lack of awareness, but at least from yesterday up to now, we have done over 1,000 cancer awareness, and you have seen the impact of the results. The people are coming are many. So we urge that all people out there to go for screening. And when you screen and you find it, whether it's at the early stage, it's manageable, cancer is treatable when it's found at the early stage. We have also partnered with other partners because alone as National Cancer Institute of Kenya, we can't manage prevention and control. We do partnership with different institutions. Like in this medical camp, when we came with the resources to do the screening, but we have partnered with other institutions to carry out the services. Like we have our partners, Kenyatta National Hospital, who are doing cervical screening, and we have another partner, AstraZeneca, who have in fact donated the machines for prostate cancer. So we thank you very much for the Ndhiwa people, for the high turn-up, and we believe that when these things will be spread in other places, this disease called cancer will be manageable. Like our team, we are here, we have another team in Meru, another team in Kwale, and we'll make sure that we reach in all other areas, and we also want all other constituencies also to copy what Ndhiwa constituency is doing. For the Member of Parliament, what he has done today, he has impacted many lives. We also do trainings. We have done also the training of CHPs. For CHPs, our full soldiers down there. Like here, we have trained from yesterday to today. We have trained around 100 CHPs, and there are ambassadors down there, and at least when they'll be going to different areas, even after we have left, they're going to spread the message about cancer. Thank you very much for the invite here, and we look to reach more other places. And as I've said, alone we wouldn't have managed. We had to partner with the other partners to use the resources we have to manage this cancer. And at this juncture, I'll invite one of the partners at least to give you the experience, because they're the ones who are dealing with the patients direct, to give at least what they have experienced with the patients here and the feedback. Thank you very much. I'll invite our partner from Kenyatta National Hospital, Benta, to come and say the experience.
I'm called Benta. We are partnering with the Cancer National Institute. I'm not from Kenyatta, but I'm from Homa Bay Teaching and Referral Hospital. we are working at the van, the Homa Bay Referral Hospital van. In the van, we are doing the screening for CA cervix. We are doing screening for the breast for women of reproductive ages. However, we also see women of above 50 years in case they have issues of reproductive regions, like if they have maybe discharge, low abdominal pain, backache, and maybe issues with the breast. So we screen them. First of all, I want to appreciate whoever did this, the organizers of this medical camp, because as an individual, I've seen a lot and our patients are really feeling good, they are helped. Because if I can say about our hospital, we usually have a challenge, especially on diagnosis. Because majorly the referral hospital, we do diagnosis for cancer. We are not a treatment site, but we do diagnosis. So after diagnosis, we refer them for treatment. But at the referral, we get a challenge, especially with NHIF, and I say Congole to NHIF team for coming here. Another Congole to Cancer National Institute for partnering with us, because they've given them as the non-consumable like speculums, acetic acid, and gloves that we are using to screen our patients. So now on points on screening, we are getting high numbers. Like yesterday, we did around 45, and out of 45, we had like 4 positives. And out of the 4 positives, we had 1 that we did thermocoagulation. Then the 2 we referred majorly for tissue biopsy, and 1 we referred for core-needle biopsy, that was a breast case. And we are very sure at the end of it all, our patients will benefit. I think that is all that I have for today.